Well, I'm Kabir Mody. I'm a consultant and an assistant professor here in the Division of Hematology Oncology, with a focus primarily in GI cancers, specifically liver and pancreas cancers. When I was a first-year fellow in hematology oncology, I had a couple very seminal patient experiences that patients with bile duct cancer and pancreas cancer that really affected me in a way where I wanted to dedicate my professional life to helping them. We're doing work on trying to find new ways of targeting tumors better. In particular, how do we leverage the immune system? How do we maybe meld that with the very different genomics of a patient's cancer? I think I'm excited about the merge that we're seeing between genomics or molecular medicine and immunotherapeutics, and the individualization of treatment that we're seeing as a result. And I think that's going to be huge for patients with liver cancer and pancreas cancer as well. What I hope to see is better outcomes from individualization of our approach to someone's cancer. It sounds a bit cliche, but and we've been saying it for many years, but I think that it's becoming clearer and clearer. In immunotherapeutics now, as we see with cellular therapies, in genomic therapy, we've also seen this, of course, for the last few years, but it's becoming even more clear. The continual subtyping of these even rare cancers to the individual level. And I think there's a lot of movement in terms of early detection too, which is really exciting. And using technologies that we have, whether they be nanomolecules or AI or radiology to detect these tumors in a better way earlier and improve outcomes that way. I think that's really going to come to the fore in the next many years. In rare cancers such as liver and pancreas cancer, funding for research is so important, right? Patients have really made a huge impact already in the last 5-10 years. We've seen a large amount of philanthropic activity, advocacy that has made real impacts, and patients continuing to advocate for themselves, continuing to get out there and raise money and ask government to fund research in a larger way is very important. It really does make a huge difference.